Unbearable menstrual pain. Why? For some women, it is part of their normal routine, while for others, it is nothing that a little painkiller such as paracetamol cannot handle. But for you, it's as though your spirit and soul is about to jump out of your body. In this video, we're diving into the topic painful menstruation, what is medically known as dysmenorrhea. We're going to be talking about what dysmenorrhea is, the types, the causes, the risk factors, the symptoms, how to diagnose it, and the treatment options that are available for this condition. Let's dive into the meat of today's video. Dysmenorrhea simply means painful menstruation. It is the moderate to severe pain that you experience during your menstrual period. Now, there are two types of dysmenorrhea. We have the primary dysmenorrhea and the secondary dysmenorrhea. Primary dysmenorrhea is the cramping pain that comes before or during your period. Usually, it starts a day or two before the onset of your menstruation, and then it lasts until 2 to 3 days after the onset of your period. Now, with primary dysmenorrhea, usually there is no abnormalities with the reproductive organs, or it is not due to a medical condition. What usually happens is that during menstrual flow, there is the shedding of the lining of the uterus, and as this shedding is ongoing, there's secretion of a natural chemical known as prostaglandins. Now, this prostaglandin causes the contraction of the muscles of the uterus as well as the blood vessels of the uterus. Now, it is this contraction of the blood vessels and the muscles of the uterus that cause the pain that is being felt in primary dysmenorrhea. Some of the risk factors for primary dysmenorrhea include early menarche, that is starting your first menstrual period before the age of 12, age younger than 20, a female who has not put to bed, smoking, obesity, and then even cold weather. For some people, it can even be a family history. If your biological mom suffered from painful menstruation, then there is a higher tendency that you could also have primary dysmenorrhea. Some of the symptoms include lower abdominal pain, lower back pain, even at your upper thighs you could feel pain, nausea, vomiting, bloating, headaches, mood changes, dizziness, name it, it varies. The thing with primary dysmenorrhea is that the pain becomes lessened after the first few days of the start of the period. Also, for many women, period pain also becomes less painful with age and with childbirth. Secondary dysmenorrhea is the painful menstruation that is caused by a medical condition or an abnormalities with the reproductive organ, and usually it comes with aging. A known peculiarity for secondary dysmenorrhea is that at the beginning or at the start of your menstruation, you were feeling all okay, there was no pain, but as time goes on and with aging, as you get to your late 20s and early 30s, you start to feel this severe pain that accompanies your period. This could be a pointer to secondary dysmenorrhea. Now, some of the causes of secondary dysmenorrhea include endometriosis, adenomyosis, pelvic inflammatory disease, cervical stenosis, ovarian cyst, uterine fibroid, and so on. But in this video, I will be talking about the two most commonest causes of secondary dysmenorrhea, and that is endometriosis and adenomyosis. Endometriosis is a medical condition in which tissues that are similar to the ones lining the uterus grow outside the uterus in areas such as the fallopian tubes, ovaries, and bladder. And then with hormonal changes that accompanies menstruation, these tissues in other locations such as the bladder, the fallopian tube, and the ovaries, they tend to bleed as well during menstruation. And as they bleed, they result in scar formation and adhesions. These adhesions can fuse organs together and cause pain. Adenomyosis is the second most common cause of secondary dysmenorrhea. It is a bit similar to endometriosis, but they are not the same thing. Now, in this condition, tissues that ordinarily lines the uterus, they grow into the muscle wall of the uterus, and this might cause pain during menstrual flow. Some of the symptoms associated with secondary dysmenorrhea include heavy and prolonged menstrual bleeding, intermenstrual bleeding, or what is known as spotting, pain during and after sexual intercourse. Dysmenorrhea can be diagnosed with the aid of an ultrasound scan, an MRI, laparoscopy, and hysteroscopy. Now, all these will be explained to you when you see your doctor. Now, what are the treatment options that are available for dysmenorrhea, be it a primary dysmenorrhea or a secondary dysmenorrhea? Now, the thing is, for primary dysmenorrhea, it can be managed at home. I call this the do-it-yourself. So if you think after watching this video that what you're managing or what you're dealing with is the primary dysmenorrhea, some of the things you can do include: 1. Exercise. Anaerobic exercise such as swimming, jogging, walking, cycling can actually be helpful. Taking an extra rest. The use of hot water bottle or heat packs by placing them on your lower abdomen or your lower back can also be helpful. Avoid food or drinks that contain caffeine. And also, for some people, taking a particular posture or position such as lying flat on the tummy can also be helpful. Medical therapy include the use of non-steroidal anti-inflammatory drugs, what is known as NSAIDs. An example is ibuprofen. Now, with this drug, the pain associated with primary dysmenorrhea can become milder. However, you have to take this based on doctor's prescription because it is contraindicated in some conditions. If you're managing ulcer, or you have a blood disease, or you have a kidney issues, you shouldn't be taking these medications without a doctor's prescription. Other medical therapy that can help to make dysmenorrhea milder include hormonal contraception, as well as the use of vitamins such as vitamin B. Supplements such as magnesium can also be helpful. These drugs can help reduce the pain, they can help reduce the symptoms that you're having. But in case of secondary dysmenorrhea, it doesn't necessarily take care of it. And this is because in secondary dysmenorrhea, there's an underlying medical condition. You need to be evaluated and then pick out the actual cause of the secondary dysmenorrhea and get treated. If you just treat the pains and the other symptoms you're having, it's still going to come up if you have not dealt with the underlying pathology. So you have to see your doctor, get evaluated to know what is causing it, and then treatment will be directed towards the cause of the secondary dysmenorrhea. Now, you need to see your doctor now. If you're dealing with menstrual pain that is not relieving or that is getting worse despite the self-care and the use of NSAIDs, then you need to see your doctor now. Also, if the pain is so severe that it alters your daily activities such as going to school, going to work, you need to see your doctor now so that you can be properly evaluated and get the appropriate treatment that you need. In conclusion, painful periods are common, but it can be managed. Now, this video is not to substitute medical care. It is just to create an awareness of what dysmenorrhea, that is painful menstruation, is and how to go about it if you're dealing with either a primary or a secondary dysmenorrhea. See your healthcare provider today to identify which you are dealing with, whether it's the primary or the secondary dysmenorrhea. And if it's the secondary dysmenorrhea, further investigations is needed to know what is causing this, because it might be endometriosis, adenomyosis, pelvic inflammatory disease, and the list goes on. This is not what you should be taking care of at home. Thank you so much for watching today's video. I believe you have learned something new. So if you're dealing with any form of dysmenorrhea, be it primary or secondary, I advise you to see your doctor today so that you can get adequate and appropriate treatment that you will be needing. Do not forget to also like, share, comment, subscribe, and hit on that post notification button so that whenever I post a new video, you'll be the first to get notified. See you in my next video.